Hospitals may feel the greatest impact of proposed spending cuts to Medicare and Medicaid in the so-called Big Beautiful Bill now in Congress. Some Senate Republicans are scrambling to include funding relief for rural hospitals to keep their doors open. Action News reporter Brisa Colon has the pushback from local leaders and how this may impact patients here in the Central Valley.
Warren, hospitals like Madera Community here could be among those hardest hit by cuts proposed in President Trump's Big Beautiful Bill. But Senate Republicans are looking at ways to set aside money that could keep these vital lifelines open. The future for rural hospitals like Madera Community is shaky, as cuts to Medicaid could be on the horizon as the passing of President Trump's Big Beautiful Bill looms.
People get in car accidents, they have heart attacks, and if you have to drive all the way to Fresno, that could mean your life or death.
The bill, passed by the House, looks to cut around $600 billion in Medicaid. The National Rural Health Association warned this week these cuts could cause rural hospitals to close all across the country. As a band-aid, some Republican senators have proposed to pour $15 billion into a new rural hospital fund, but others say that's not enough and are asking for up to $100 billion.
I agree with some of the Republicans that are skeptical about whether $15 billion is enough to save rural hospitals across the country.
Assemblywoman Esmeralda Soria says even though the hospital is back open, it's not financially in the clear. She's now calling out Valley representatives in Washington who voted in favor of the bill.
I'm very disappointed that Congressman Valadao actually voted for this big, beautiful bill, because I can guarantee you that some of his hospitals will close.
In a statement, Congressman Valadao defended his vote, saying, quote, "This bill honors my commitment to protect Medicaid for our most vulnerable populations while implementing common sense reforms to strengthen the program." Proponents of the bill say the cuts are aimed at reducing waste, fraud, and abuse, but some California leaders warn Valley hospitals will have to pay the price.
If you walk through that emergency room door, regardless of what your situation is, the hospital by law has to serve you. So if you don't have Medi-Cal, then the hospital eats those costs, which cuts even more into that margin.
Experts estimate that under the Big Beautiful Bill, hospitals will lose 21 cents out of every dollar they receive in Medicaid funding. Many already struggling, will not be able to recover from.
Every small town should have their own hospital. I think it would be a big shame to lose a hospital for the community of Madera.
And President Trump said today that he is remaining hopeful that he'll be able to get this bill passed by the July 4th holiday. Reporting in Madera, I'm Brisa Colon, ABC 30 Action News.